Urogynecology, or pelvic floor medicine and reconstructive surgery, is a specialty now. It's even more of a subspecialty that focuses on managing what we call the pelvic floor disorders. And pelvic floor disorders are either related to pelvic prolapse, meaning more so the relaxation of the vagina or the uterus, or urinary incontinence, fecal incontinence, which means the involuntary loss of urine or stool. Sometimes chronic pelvic pain can be from the pelvic floor, and some disorders in the pelvic floor in that arena could cause painful symptoms as well as cause problems with the urine control as well. As a medical student, as a resident in obstetrics and gynecology, and having went through 2 residencies, of course, there's no if or but about it that the miracle of giving birth, obstetrics all by itself, and the intricate physiology between the mother and the baby is unique and kind of mind-blowing. But over time, I started to see that our patient we take care of and they give birth, sometimes birth is not as easy, and sometimes it's complicated, sometimes it's difficult, sometimes it's traumatic, and most of the time it does have some effect on the pelvic floor of the patients. You know, we'll talk about pushing and some trauma to the pelvic floor, and fast forward 30 years from that incident, or even sometimes shorter, patients will end up having some symptoms that are related to that incident, to the delivery, to the traumatic delivery, or just delivery itself can be a risk factor for pelvic floor problems like urinary incontinence or prolapse. They're not life-threatening, but they have heavy impact on the patient quality of life, on their intimacy with their partners, with their family, with what can they do as far recreational activities. They cut down on their sports, they cut down on their social outings because they are dealing with something that they think is normal. And even though it's common, because giving birth is common, you know, the more children we have, the harder the impact on the pelvic floor. And for that, patients tend to feel like, you know, they're not alone suffering with this, but they don't think, or they don't know that this is actually something we can do about this. And the most difficult part is really to be able to talk and speak up and say, you know, I'm dealing with this problem. I know it's common. I don't think it's normal. Can you help me? And this is really starts the conversation in the clinic, to try to just tell the patient that this is pretty common, and we know that you might be having problems. So I kind of have to ask the question, how is intimacy going? How is your bladder control? You know, it's common that patients will have problems with urine control, and if you do happen to be one of them, please let me know, because I think I can help you.